Let's talk about how people, process, and technology should factor into your social needs screening workflow. When deciding on a social needs screening workflow, it is important to ensure that the people, processes, and technology involved align with and reinforce each other. In this case, people refer to the health center staff that are assigned to perform specific tasks, such as screening patients for social needs, meeting with patients to address their social needs, or monitoring social needs data. These tasks are often guided by a process and rely on technology. It is important for health center staff to understand what is expected of them, how they fit into the process, and what tools they can use to be successful. Process refers to what health center staff are doing and how they are organized within the social needs screening workflow. Technology refers to the tools that health center staff rely on to carry out the social needs screening workflow, like the EHR, reporting tools, electronic forms, and more. If used correctly, technology should support health center staff in accomplishing their tasks efficiently and sustainably. Implementing a social needs screening program is an ongoing and iterative process. Health centers can determine the workflows that work best in the context of their organization through trial and error. Let's take a look at the factors that one health center took into consideration when developing their social needs screening workflow. At the PPT Health Center, staff initially decided to collect social needs data by building their own structured data fields into their EHR. After testing this out, staff shared that because data could not be easily extracted from the structured data fields, and because the fields did not automatically score the prepare form, it wasn't easy to see the immediate needs for the patient. The PPT team went back to the drawing board to brainstorm a new process that used technology in a way that supported their staff and improved the quality of care for their patients. They decided to try using a prepare smart form to collect the social needs screening data in their EHR instead of using the structured data fields. The PPT Health Center staff tried out the new process, and it worked. Collection of social needs data was much easier with the new smart form. Providers preferred the smart form because it reduced the number of clicks necessary to access the screener, pulled demographic information that was collected at registration into the form, scored itself, and created dashboards with population-level data and patient-level data. Let's review what we've covered in this video. Implementing a social needs screening program is an ongoing and iterative process. When deciding on a social needs screening workflow, it is important to think about how the people, processes, and technology involved can align with and reinforce each other. Health center staff should work as a team to identify the social needs screening workflow that works best within the context of your organization. As you undertake social needs screening implementation in your own health center, what people, processes, and technology do you need to consider?